Standing here on these library steps, everything looks calm, quiet, predictable. But you know that in a library, at any moment, things can change. A sudden noise, something odd going on, someone rushing into the room. And that is when we know that things can change instantly. Encephalitis is very similar. We're not looking for some dramatic neuro change. Sometimes it's just the subtlest little clues that give us an indication something's changing. And this is where students often miss it because they're looking for that big dramatic neuro change. See, students are often looking for major things, seizures, coma, major deterioration. But often it's those small changes, those subtle behavior changes, something that you just notice something's not right, not anything major and dramatic. Our big clinical judgment principle for today is that in neuro, sometimes the first changes are as subtle as a whisper in the library. See, really, you're looking for a change in the patient's baseline. You don't need something loud and outrageous. You need those subtle, quiet whispers. First, let's start with some things we know about encephalitis. That itis ending tells us it's inflammation, and that often comes from viral changes. Secondly, encephalitis often mimics other things like flu and confusion, so it's easy to dismiss. And third, the earliest danger is increased intracranial pressure, ICP. And sometimes that happens before we ever see any neuro changes. And all right, here's a simple 3-point framework for you to take with you today. Behavior, cognition, and responsiveness. If any of them seem a little bit off, that's like a whisper in the library of the brain. So what does it mean to find neuro subtle changes that are like a whisper? Well, for one thing, we're going to ask, is this different than the patient's normal? We're going to ask, is this different than any other day? And we're going to ask, is this a meaningful change? See, these are encephalitis pattern recognition techniques. And if we can recognize that the pattern is shifting, then our next step is going to be to ask why, and then hopefully do something about it. See, these are 5 neuro cues that you should never ignore. The first one is new irritability or confusion. This is like somebody talking loudly in the library. The second is mild confusion or a delayed response. It's like you're standing there saying, "Come on, dude, give me a response." Next is a combination of 3 things: headache, fever, and confusion. If you have those 3 things going on, it's definitely telling you something's going on neuro-wise. I just noticed it got really, really sunny outside the library here. And that reminds me that photophobia or neck irritability, neck pain, can be signs of neuro changes as well. And 5th, never blow this one off. If a patient says, "I just feel weird." Okay, if any one of those 5 things happens to your patient, you need to immediately think, is this inflammation? Is this something I need to escalate before it becomes a major problem? So what does a nurse do if you notice 1 or more of these 5 changes? First, a thorough neuro assessment. Secondly, you need to notify the provider right away. You don't want to wait on this. And third, you're going to have to prepare for diagnostic testing like an MRI or a lumbar puncture. You'll probably receive orders to start monitoring for intracranial pressure changes. And one thing that we can always do as nurses is create a quiet environment, much like the library environment we're talking about today. If you've been following along with the Summer 2026 Clinical Judgment A to Z series, you're probably noticing a pattern because at this point, I'm going to tell you that you're starting to think like a nurse. You're noticing those subtle cues that many people just miss. And that is your clinical identity. That means you are becoming a great clinical judgment thinking nurse. Just like in the library, encephalitis teaches you to notice those subtle changes that interrupt the quiet, calm, predictable environment. Let's face it, not all of your patients are going to be neuro patients. And they're not all going to have subtle changes like you would see in one of a quiet library scenarios. but all of your patients have baseline statuses. The best thing that you can do is to notice the baseline in your patients so that you'll be easily able to pick it up if there's a change going on. If you enjoyed today's episode, be sure to join me next time where we'll be touching on the letter F and we'll be talking about fungal infections. Hope to see you there.